Welcome to the first session of this series, and our series theme is Reclaiming Goodness, Truth, and Beauty. And so, as we were talking about different topics that we wanted to see, all the speakers that we started finding really had ways of addressing just these themes of truth, goodness, and beauty, and as they relate to our Catholic faith and to kind of issues we face in society. And so today's talk will be on reclaiming gender, and that I think this talk is really going to be very relevant to this theme. And so our presenter is Dr. John Rice. He's a pediatrician who's been in practice for more than 30 years, which is so cool. And he currently is at South Bend Clinic. He's a Notre Dame grad. He received his bachelor's there, and then he went to complete his medical degree in residency at Indiana University School of Medicine. He has presented on this topic of gender identity to Catholic schools in our diocese, and he is married and has 7 kids and is one of 10, you said? One of 10. So please help me welcome Dr. John Rice.
Thank you. I hope you'll be clapping at the end of the discussion as well. It is a pleasure for me to be here. This is a wonderful group, and I'm especially pleased to be, at least for one night, counted among the young adults in the diocese. It's been a long time since I've been in that group, but I appreciate it, and seeing young adults here really gives me the hope for the church. Some of the things we're going to be talking about that have happened with regard to marriage, the family, gender ideology, etc., are things that have really taken the church and society in a very negative direction. And it's very hopeful for me to see so many young people who are interested in their faith, interested in joining together with other young people to build the faith, to build their families. And this really is going to build the future of the church. So thank you for coming here. Thank you for all you've done so far. And I wish and pray the best for you as you continue to grow in your faith. As was already mentioned, today's the Feast of St. Thomas Aquinas. And this is a particularly important juxtaposition, and God doesn't work in coincidences, so I think he had something to do with this. Thomas Aquinas is one of the preeminent theologians in the church, lived back in the 1200s. Which of us can hope to still be read and studied 800 years from now? So Thomas really has a special role in the church. And one of the important things about Thomas is that he really illuminates the idea of truth. And he took the philosophy of Aristotle and he fit it into the Christian faith, the Catholic faith, and brought into the Catholic faith a very deep understanding of the concept of truth. Truth, for Thomas, is something that's independent of our perception of it. And that's important for what we're going to be talking about tonight, because that's really the whole controversy in the gender identity issue is which is preeminent, the perception of gender or the fact of how we're created. Thomas would tell us that truth is something that can be known, that each of us can come through the light of reason, through our natural intellect, can come to know the truth. Sin in our human state has darkened that intellect and left us groping sometimes for what is the truth. And some of the situations that people find themselves in are because they have an imperfect understanding of the truth. Thomas also would tell us that revelation and the magisterium are sure guides to the truth, because God and his church cannot err. The church doesn't pronounce specifically on matters of science, but the church does have a very important voice when we talk about where science intersects with the human person. And it's up to the church And we'll see later on how the church has responded and articulated some of these very important principles about who we are as human beings. And once you understand who we are, that determines what we can do and what the limits of what we can do are. So the church isn't trying to put limits on science because the church is trying to control science. The church is simply saying it is the church's purview, it's the church's responsibility to guide us in matters of the human person and our relationship to God. So it is very proper and necessary that we speak about this tonight and speak in medical and theological and sociological terms because these are all particular dimensions of the human person, but it is important that we bring all those together because truth, after all, as Thomas again would tell us, is one. There's not scientific truth that would contradict medical truth, that would contradict political or sociological truth. All truth in the end is one. And in fact, all truth is not even a thing or an idea, it's a person. A person who 2,000 years ago said, I am the truth. So as we do this, as we study this topic, as we study everything relating to our faith, we have to be confident that we know the truth and we have access to the truth about ourselves and about how we're created. And we can't be shy about that because our society needs this. Our society desperately needs the vision that the church has for who we are and how we ought to act. So tonight I'm going to talk about some definitions, what we mean when we talk about being transgender, or when we have gender identity, or some of those other terms that you've probably heard and you probably have some understanding of, but I want to make sure we're all talking about the same thing. So we'll talk about those. We'll talk about what it means to transition, to change gender, and some of the medical aspects of what's involved in that, because it's a pretty complicated process that people are willing to go through. I want to make a couple of preliminary remarks. This is a topic that in our society has generated a great deal of emotion, of anger, of sadness, of other tremendously strong emotions, because this is something that affects people very deeply. It affects the very core of who they are. It's very important that we realize that when we speak about these concepts, I'm speaking about the ideas and not the persons who hold them. So I may speak about the idea of being transgender as not compatible with the faith. However, I do not mean to demean the dignity of anybody who holds that or who in fact is affected by that condition. So I want from the very beginning to extend a very warm welcome and a deep compassion and understanding towards those who are afflicted with this difficulty, with this gender confusion. And I want to be very conciliatory toward those who hold that opinion or who teach it, because I have to assume the best of intentions. As Thomas again would tell us, people can have the best of intentions and still be wrong. So because people are very sincere and hold something very strongly doesn't make that viewpoint more true or less true, but we always have to recognize the dignity and the importance of the person, especially when people are suffering in this way. And this is a type of suffering. When people are suffering in this way, we're called to accompany them in their suffering, and there's no better accompaniment than to lead somebody to the truth of who they are. So we talk, first of all, about biological sex. We open up Genesis, male and female, he created them. That seems to be a simple concept, and for nearly 2,000 years, there wasn't much question about it. There's male and there's female, one and one. There's two. Unfortunately, in the last 50 years, science and psychology and other fields have developed the notion that sex is not a binary concept, but rather a fluid concept, a continuum where you can be 70% one, 30% the other, 50-50, or nothing at all, or one day you're one thing and one day you're another thing. So it becomes much more difficult to nail down. And it's important to understand what people mean. So they'll use terms like gender fluid, which means I could be anything on any given day. They'll use terms like agender, which means I don't proclaim myself either male or female. Or they'll talk about feeling transgender, which means I am biological male, but I identify as a female, or vice versa. One thing that sometimes gets confused with this is the problem of intersex or ambiguous genitalia. This is a medical condition in which probably 1 in 4,000 or 5,000 babies has a metabolic defect as everything's forming inside, and the genitalia don't form normally. So when you look at the baby as the baby's born, you can't look and say immediately, this is obviously a boy, this is obviously a girl. In that case of ambiguity, more medical investigations need to be made, and the decision needs to be made about how to repair what has gone wrong in nature. That's not what we're talking about here. Those are certainly cases that we can talk about, and there have been some interesting kind of natural experiments where people have been genetically one sex but raised the other. But in the cases we're talking about of gender identity issues, the physical appearance is unambiguous. These people are absolutely, clearly male or clearly female in their outward appearance. So there's nothing ambiguous about them. And in fact, they feel that they're trapped in the wrong body, but very definitely a male body or a female body. The other thing that we're not going to be directly addressing here is the issue of sexual attraction. So sometimes, because the acronym is LGBTQ, I don't know what else is added there, but because that acronym compresses all of those so-called sexual minorities, people often conflate being homosexual with transgenderism. Being homosexual or having same-sex attraction is a condition of sexual attraction, but the person who is a male who's attracted sexually to other males knows he's a male and knows that this other person is a male and is attracted precisely for that reason, rather than being unsure of your own identity. Now, there is a higher incidence within the population of people who have gender identity, also of sexual identity disorders. So very often those can occur together, but they're two separate disorders. They're not the same thing. So again, that's not our topic tonight. And as I mentioned, both of these groups of people, I want to make clear that it's important not to reduce somebody to their sexual preference or their sexual identity, or to any other single aspect of them. To say somebody is a homosexual or is transgender reduces everything about that person to that one aspect. And it takes away from so much of the complexity and the completeness of who we are as human beings. So I would prefer to use the terminology a person with same-sex attraction or a person with gender identity issues, rather than saying this is a transsexual or a homosexual or something else that reduces the person. It's very important for us to keep in mind that these are persons. When we talk about gender, as we come back to the idea of a person, what is a person? A person is a unity of body and soul. A person is not a soul that's just trapped in the body. The Christian anthropology speaks of us as a body-soul unity. The movement to separate the two, to allow us to speak of one gender trapped in the wrong body, really reduces the person to his non-physical attributes and says that the body is just a shell in which that person is trapped. And that's a very different way of looking at the person compared with the Christian view. Gender itself, the term, is our awareness of our identity as males and females. So your biological sex is established from the moment you're conceived. It's evident on the ultrasound, it's evident at birth, it's evident throughout your life. Gender is something that is subjective. It's a subjective concept in which we become aware of our masculinity or our femininity. Identity develops early in life. So I see a couple of people with little kids, and pretty soon those little ones are going to say, am I a boy or a girl? And mom and dad are going to say, of course, you're a boy and you're a girl. And that's how that identity is built. Gender identity has to be distinguished from gender roles. Gender identity is how you think of yourself. Then you have gender expression, which is how you present yourself to the world. If you see yourself as a young woman, then you put dresses on, you put nail polish on, you do girlish things so that you present yourself to the world as a young woman. Likewise, a young man would present himself differently to the world to show that he is a young man. So there's gender identity, gender expression, and then gender roles. The church doesn't say that only women can become teachers and nurses, and only men can become doctors and truck drivers. Gender roles may vary as long as whatever role we take is one that's consistent with our identity and consistent with our vocation in life, our calling to live out that identity. Gender identity as a pathology, as a disorder, was listed in all the psychiatric manuals up until 2013 as gender identity disorder. And this made it defined it as a person who is one biological sex who perceives himself as the other. And it took the biological sex as a given and said that the disorder was in the person's perception. And all the way up until 2013, that's how the psychological world viewed it. In the most recent edition of the DSM-5, the Diagnostic and Statistical Manual, which kind of lists the criteria for all the psychological diagnoses, these two things were flipped. Now it's described as gender dysphoria, and the biological sex is seen as the problem, and the person's perception is seen as the truth. So gender dysphoria occurs when you realize you're one sex, you look at your body and you say, I'm in the wrong body, and it bothers me. The dysphoria means I'm somehow affected by it. So the pathology is not the altered perception, rather the pathology is the distress caused by what is held by science now as a true perception. When people say, I am one sex, but I think I'm the other gender, they'll speak of either being cisgender or transgender. If you remember your chemistry, when two molecules were on the same side of the compound, they're cis. When they're on opposite sides of the bond, they're trans. So if you're cisgendered, that means you line up symmetrically. So you're a male in a male body. If you're transgendered, you believe you're a male in a female body or a female in a male body. How often does this happen? It's hard to study topics like this specifically, but the best estimates are that in the adult world, fewer than 1%, probably about half of 1%, of people are truly gender confused, whether you use the gender identity or gender dysphoria term, people who believe that they're in the wrong gender. So it's an infrequent pathology that happens. It does tend to occur more often in childhood. The natural history, interestingly, in childhood is that between 70 and 90% of people will, or little children, will resolve their gender identity issues during childhood. So if you have a 3-year-old or a 4-year-old who believes he's a girl or she's a boy, they may persist in that for a little while, they may act on it, but generally that resolves on its own. So it's only a very small proportion of young children who will persist into older adolescence and adulthood. Those who persist, or those who maintain that their gender is different by the time they're in later adolescence or adulthood, those people most likely will continue to persist into adulthood with that belief. So what do people do when they feel like they're trapped in the wrong body? Well, sometimes they just have that feeling and they say, oh well, they just live their whole life believing that they're in the wrong body and don't do anything about it. The current recommendations medically, and this has been a major shift within all the medical bodies within the last 10 to 20 years, current recommendations now are, rather than support the person in discovering their true identity, the current recommendation is to affirm the person's stated identity and to assist them in what other way they need in transitioning. So that would take a young child who says, I look like a boy, but I think I'm a girl, and the parents would be told, run with that. Help him become a girl. And that, when you look at those studies now, it's an interesting experiment we're running without informed consent, without controls, because when children are assisted to transition, both socially and then medically, almost all of them will continue to transition. So you take this group of people that had a very high rate of resolution, and by encouraging them in their thoughts about their gender difference, they end up going down that road of transitioning. And some of the steps of transitioning are difficult or impossible to reverse. So when we talk about transitioning, we'll talk about several stages. The first is social transition, where that child who thinks he's a girl tells everybody in the family, don't call me Johnny anymore, call me Susie. I want to wear a dress, and then begins to do the same thing on the outside. I want to go to school wearing a girl's uniform and not the boy's uniform. I want to play on the girls' basketball team, not the boys' basketball team. I want people to refer to me as her instead of him. And all of this is contained in that phrase, social transitioning. And this is what has led to a lot of social upheaval when we talk about bathroom laws. Can this child who is anatomically and in every other way male, but believes himself to be a female, can he dress in the girls' locker room? Can he shower in the girls' locker room? The legal system would say, yes, he has that right, but the parents of all the other girls in there would say, that's a problem. We'll talk a little bit more about the social implications later. But social transitioning, while it seems like it's a completely reversible step, because next summer Johnny could come back to school and say, I'm Johnny again, I'm all better. That was just a stage. But the damage has been done, because forever he'll be known as the boy who was a girl for a year. Forever, and this will live forever on social media and on the internet. When he's interviewing for a job 30 years from now, somebody will find that. So it's not a completely reversible thing. It also takes him away from some of the normal developmental jobs he should have done. If an 8-year-old boy should be playing with other boys, learning what boys do, learning how to be a young man, and instead he's been modeling himself as a young woman, he's missed some of that development that he should have had. So it's not completely reversible, and it tends to lead, if you encourage that social transition, it tends to lead to the next step, which would be requesting medical help to make bodily changes. Remember, this 9-year-old is prepubertal, and if you dress him in the right clothes and style the hair the right way, he could look a lot like a boy or a girl. Things are going to happen in a few years. They're going to make it very difficult for a 13-year-old boy or a 13-year-old girl to present himself or herself as the opposite sex. And if you're a girl and you think you're a boy and you start looking more and more like a young woman, that causes a great deal of distress, and that's real. That's a real distress. And yet the medical world now would fix that by saying, okay, we'll stop those changes. We'll take that normal developmental process, that pubertal development, which is a normal bodily function, and we'll stop it. And if that's not enough, we'll stand it on its head, and instead of letting you develop in the direction your body intended to develop, we'll force the body to develop in the opposite direction. So the first stage that you hear about is called puberty blockade, which sounds innocuous because it's kind of a timeout. It takes the child out of the whole pubertal process. There are some medical risks to that, and we can talk about those later on, but it's not a benign process. It's also one of the few situations in medicine where we take a normal body process, something that's working in a very healthy way, and we stop it. We treat it as a pathology, not as a normal process in the body. And it also makes it harder to go back to what you were. Imagine the 10-year-old who decides, I want to stop this whole pubertal process, And 4 years later, where have all his or her peers gone? They've all gone through puberty. They're all bigger, taller, stronger. They look like young men. They look like young women. And here's this little kid who still looks like a fourth grader. Doesn't that increase the sense of isolation, the sense of being different, the sense of somehow not belonging, and can easily add to that child's psychological stressors? Puberty blockade is only a temporary thing. There are some questions about whether stopping that process also stops some of the normal psychological development, some of the brain development, and again, we can go into the scientific aspects at some other point, but it's only a temporary thing, because at some point you have to decide, are you going to stop the blocking hormones and let normal puberty take place, in which case you take on the appearance that nature intended you to have, or do you affirm the gender transition? That is, do you start giving this person what they would call cross-gender hormones or gender-affirming hormones? And usually this is started by about 16 years of age, by the time you would have finished puberty. Sometimes it's been proposed now to start it earlier.